Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
So the doctor took out his video stroboscopy and he looked at it, and then when he checked it, he said, "Oh, seems like it's gone." He pulled out the camera and checked it again. Then he was saying, "I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do?" Then he pulled out it again and checked it again. He sat down and said, "It's gone." Hi, my name is Nesta Vicencio and I'm 32 years old. I'm an insurance agent, so I'm in sales, so you could think of I've been talking a lot, and I regularly sing because of ministry. So I sing on Sundays, so I use my voice a lot. Starting January 27, I started losing my voice, and then the hoarseness remained for more than 2 weeks. And this started bothering me, like what's going on with my voice? It's taking too much time. 2 weeks and a few days, I decided to see my ENT doctor, and he diagnosed me with chronic laryngitis. And then, for the first meeting, he asked me to take steroids. The point is to remove inflammation. So he's saying that probably I have throat inflammation because of voice use. So fast forward to taking the steroids for a week. I've been on voice rest, and whenever I test my voice, the hoarseness is not going away. I'm still strained. Whenever I try to talk, it gives me pain on my neck up to my head because it feels like I'm using head tone every time I try to produce sound. So I went to a different hospital, and a different doctor did the video stroboscopy to see what's going on with my voice box, my vocal cords. And when he did that, I already felt nervous about what I'm seeing on screen. And then when he started saying that you have a vocal cyst and the only way for this is to undergo surgery, tears started falling down my face and I just couldn't help it. As someone who uses my voice every day in everything that I do, in my work, in my ministry, talking, singing, it's like too much for me to take. I asked for the recovery and the doctor said, for now, you need to go on voice rest to remove the inflammation. Take the steroids to remove the inflammation. Once you're cleared, then you can go for surgery. And that's the only way. I said, so if I will have vocal surgery, will it affect my voice? Then they said, you will be able to speak again. But as for your singing voice, we have no assurance for what will come out. Honestly, after the 5 doctors, it felt like, okay, there's no other way but surgery. And then one day, our good friends, Sister Jazz and Pastor Shan, they introduced me to PPAR's extract. This product helps with cysts, tumors, and it helps, and it's all natural. So for me, what would I lose by taking something natural and non-invasive and something that's recommended by people I trust, people I love? So I said yes to them because I'm at the state where I really want another option other than surgery. So at first, they recommended me to take the PPAR's extract liquid, which is a liquid form of PPAR's, and they asked me to take it for 3 days. Then after that, they gave me PPAR's extract powder. And then after 2 days or after 2 vials of PPAR's extract liquid, there was a morning that I forgot that I'm on voice rest because I just woke up. So I just woke up and greeted my husband, and my husband was like, "Why are you talking? You're supposed to be on voice rest." And we were both like shocked that, "Oh, I'm not supposed to talk." And then he said after, "But baby, your voice sounds better. It sounds normal." So I tested my voice again and said another line. And we looked at each other and said, "It sounds normal." And this time, it's just on my second vial. After 5 days, so 3 days vial for the first 3 days, and then on the 5th day, on the 4th and 5th, I'm already taking the powder of PPAR extract powder. So I got so excited and curious, so I went to see my doctor. I will never forget this moment because when I entered the room, my doctor said, "So what's your plan with your life? When are you going to do your surgery?" And I was like, "Oh, doc, I'm done with taking the steroids. I'm done with my voice rest. I've been on voice rest, strictly doing it." And then when I was talking, my doctor said, "Is that your normal voice?" And then I told him, "Yeah, it is my normal voice. Does it mean I'm okay?" And then he said, "Well, of course, probably because of the steroids," which I didn't tell him. Before taking PPARs, I decided to throw away my remaining steroids tablets because I've read about it. It's not really good. So on my own, I decided to throw it away and start taking PPARs. And then he said, "Oh, probably it's just the steroids because the inflammation is gone. That's why you're back on your normal voice." I said, "No, the cyst will not go away on its own. So it's probably the voice rest. So come, let us check it." So the doctor took out his video stroboscopy and he looked at it, and then when he checked it, he said, "Oh, seems like it's gone." He pulled out the camera and checked it again. And he was saying, "I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do?" Then he pulled out again and checked it again. And then that's through the mouth. And then he said, wait, one more time. I'll just try it through the nose." So the doctor who was supposed to finish our appointment said, "Oh, one last time. I just want to see it one last time." So he tried it through the nose. And he checked through the nose. He said, "It's really gone. Oh, can you tell me everything that you did? I need to document this. Is it okay if I write a report about your condition? Because the cyst is gone." And then he said, "Oh, maybe I will see you in 2 months. Just come for a checkup. Let's see what will happen. But you can continue with voice rest. Don't get too excited." So I'm really, really grateful that I got introduced to PPAR's extract, the liquid and the powder.
So Simply Nature PPARs actually have very strong anti-inflammatory properties and anti-inflammatory nutrients. So with Nesta's case, being her voice box is inflamed, no? Which eventually led to her vocal cords developing cysts. With less inflammation inside Nesta's voice box, it eventually led to the resolution of her vocal cord cyst.
When you get diagnosed with this, and the doctor would say that the only option is surgery, of course, it's good to listen to your doctor, but it will not harm you to try PPAR's liquid extract and even the PPAR's extract powder so that you can get better.
Where will you go? My heart is open wide.
Pwede daw dun sa mga life stage na pagdadaanan ng mga tao. Merong iba't ibang priorities. So we have protection.
My name is Nesta Vicencio, and I trust Simply Nature.
Simply Nature. My name is Jenny Lay, and you are watching the 119th episode of Simply Nature webinar powered by SMG or Simply Healed Medical Group. Before we dive into the topic of diabetes and breast cancer, I'd like to welcome each and every one of you. Please feel free to introduce yourself in the chat box or comment section. Let us know where you're watching us from. We have registrants from all over the Philippines and Asia, also from Middle East. This is a free webinar, so if you have relatives or friends with diabetes or breast cancer, feel free to share or tag them. I'd like to greet our viewers, Miss Grace, Aled Zurk, Isay, Arlene, Beline, Emery, Ashley, Nenit, Emeline, Silva, Maki, Frederick, and Lily. All right, now I am sure you can't wait to learn how to manage your blood sugar. So joining us is a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International. Our people's expert, fresh from Taiwan. Let's all welcome back Mr. Shyan Lim. I'm sure they all have missed you. Oh, you're on mute, sir.
Hi, Jen. So good to be back. I'm actually not only back from Taiwan, I'm actually back from Singapore as well. So actually, we just spent the weekend celebrating with my mom's 74th birthday, I think. Yeah. So so glad to have everybody back here again. Tonight's topic, we're going to talk about two important things. We're talking about breast cancer. We're going to talk about diabetes and how these two come together. So again, welcome to all of our viewers, especially our new viewers. And let's hand the time back to Jen and introduce Dr. Jansen, and let's get going. Remember, we have an Ask Me Anything segment right after Dr. Jansen's sharing. So stay in tune for that. We always get interesting questions, and I'm sure if you have a question, just ask and we'll help you as best as we can.
Thank you, Sir Shyan. Now it is time to hear from another expert. Dr. Jansen Kalalan graduated from St. Luke's Medical Center, College of Medicine in 2016. In 2019, he was conferred as a diplomate of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He is also the president of Simply Healed Medical Group and a consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas, where he manages patients with cancer and metabolic illnesses. So let's all watch his patient case presentation.
Hi everyone, this is Dr. Jansen Kalalan, your lifestyle medicine doctor and the president of Simply Healed Medical Group, helping you in your recovery from cancer. So today we're going to discuss another patient of mine who was diagnosed with breast cancer. So this is a 63-year-old female who recently had mastectomy. After mastectomy, it was found that her type of breast cancer is luminal A. This is also known as your ERPR positive or hormone receptor positive and HER2 negative breast cancer. Now because of this, she is only maintained on letrozole, which is your hormone therapy for this kind of breast cancer. Now, recently, she had a repeat breast tomosynthesis, which came out as normal. So, breast tomosynthesis is also another kind of breast mammography. No? It's just that tomosynthesis is in 3D rather than in two-dimensional. Furthermore, her bone scan has no bone metastasis. So it's safe to say that this patient is currently on remission. Her other pre-existing illnesses include diabetes, hypertension, and dyslipidemia or high blood cholesterol. Her medications are as follows. Okay, so you have your letrozole, you have your Janomit. Janomit is a medication for diabetes. It is a well-known medication for diabetes, no? And Janomit is the brand name for sitagliptin and and metformin. Next, she also has rosuvastatin, which is your medication for cholesterol, losartan, amlodipine, omega-3, and calcium. Her omega-3 and calcium, I actually told her to stop taking already, no, for reasons later I will tell you. So this is her laboratory actually prior to her consulting with me. So this is, I saw her October 2022, and this is her laboratory result last July 2022. So as we can see here, the notable abnormal parameters would include your ionized calcium, which is a little bit on the low side. Her HbA1c is actually within within target. Okay, although for HbA1c, for those of you who are diabetic, no, what are the cutoff values for HbA1c? So what is considered as normal is an HbA1c value of less than 5.7%. Okay, what is considered as pre-diabetes is a value between 5.8 and 6.4. So anything above 6.5 is actually diabetes. Now for her case, her HbA1c is at 7%. Yes, this is in the diabetic range. However, she is on anti-diabetic medications, so we cannot have her HbA1c too low because this risks hypoglycemia, and at the same time we cannot have her HbA1c very high because this would be uncontrolled diabetes, no? So for diabetic patients, the HbA1c goal should be 7, okay, less than 7% actually. For our patient's case, as of July 2022, her HbA1c goal is within target. So next, other notable ones would be your cholesterol levels, which is at 6.26, which is really very high. This is crazy high actually. Her triglyceride level is at 1.87, slightly high, although still very high. So with this, I recommended for her to take PPAR soft gel once a day to enhance insulin sensitivity. Also to manage her cholesterol levels and triglyceride levels, since PPAR agonists can actually help enhance fatty acid metabolism. Furthermore, I also recommended for her to take Caltrate Plus 500D and a vitamin D3 supplement. These are the two supplements that I recommended for her to replace her purely calcium supplement. So the main reason being is that vitamin D3 actually helps our body absorb calcium from our intestine. So this might be one reason why her ionized calcium levels is relatively low. After a few months, so this is December 2022, she had another round of laboratory results. Her ionized calcium increased actually to 1.11, although it's still relatively low. However, at least it's now slightly below normal values. Okay, so clearly the calcium supplementation and the vitamin D work. However, here's the problem. Her HbA1c actually increased by 0.1%. Now, at face value, may seem that this is quite insignificant in increase. However, later on, for reasons of diabetes, no, and breast cancer, this is actually not good. Also, her FBS or fasting blood glucose is at 7.86, which is really high. Okay, now this explains why her HbA1c level or the glycated hemoglobin level increased. Furthermore, her cholesterol level, now this is the good news, no? Her cholesterol level actually went within normal limits already, from 6 down to 4. At the same time, her triglyceride levels also became normal. Now, this might be because of her medication, rosuvastatin, okay? However, I believe that the PPAR soft gel also helped her control, no? Helped her control for these two parameters as well. Also, if it were not for the PPAR soft gel, I think the HbA1c might have increased more. For reasons I will explain later. Now, after a few months, on March 2023, she had another round of breast ultrasound, which came out as normal. The following month, on April 2023, she followed up again with me. So upon further investigation, why her HbA1c levels actually increased, no, rather than go down, one explanation would be she's still using oil in her cooking, right? And she was not able to adhere to a plant-based diet. For patients who are diabetic, it is very important that you adhere to a plant-based diet because, number one, a plant-based diet is very high in fiber. Having high fiber content in your diet is very important because the fiber acts sort of like a sponge, no? So that when you eat, the carbohydrates or the glucose won't be absorbed by your intestine altogether. And if the or if the sugar in your diet or the carbohydrates in your diet is not absorbed immediately by your intestine, then you won't have blood sugar spikes. So if you won't have blood sugar spikes, there won't be spikes in your insulin. Also, oil. Oil is actually the root cause, or fat toxicity is actually the root cause of diabetes. Okay, so how does this mechanism come about? Now, if you use so much oil, if you have so much fat in your diet, what will happen is that your triglycerides will increase. If your triglycerides increases, then your triglycerides or the fat, okay, triglycerides is fat, no? So the fat would be stored in your fat tissues, it will be stored in your liver, it will be stored in your pancreas and elsewhere in your body, especially the muscles. Now, if the fat storages are saturated or become full, no, then there will be spillovers already. Now, for example, your liver. If your liver is full of fats already, you can develop fatty liver. Then if it is not reversed or if it was not treated, then your fatty liver will become liver cirrhosis eventually. When your liver goes into cirrhosis, that's not reversible already. Okay? And once you have cirrhosis, the chance of developing liver cancer is very high. Now, aside from the liver, where else can fat be stored? It is in your pancreas. When your pancreas gets laden with fat, no, if it becomes infiltrated with fat, the pancreas can get damaged because of the inflammation. And what's the main function of your pancreas? The main function of your pancreas is to produce insulin. Now, the main function of insulin is to what? It's to lower blood sugar after eating, so that your blood sugar can be utilized by your cells as fuel. If your pancreas is laden with fat and your pancreas becomes inflamed, the pancreas will get damaged. If your pancreas gets damaged, the insulin production will go down. If your insulin production goes down, what will happen to your blood sugar? It will manifest as high blood sugar, especially after you get your blood checked in the laboratory. And when we doctors see that you have a high blood sugar, that is diabetes. Now, for that matter, no, we are talking about very low insulin levels already. Okay, so the pancreas being damaged. There's another one. Now, there's another mechanism here where insulin resistance happens, which is in your muscles. Now, when your muscles are infiltrated with fats, then it will be very difficult for the glucose channels to open when insulin attaches to them. Now, when your glucose channels don't open, then your blood sugar will not go inside your muscle so that it would be utilized as fuel. So this is what insulin resistance means. Now, insulin resistance again is rooted in fat toxicity, not sugar per se. Okay? Excess sugar, the role of sugar in diabetes is that when you eat a lot of sugar, excess sugar will be turned into fats, which will further fuel this vicious cycle. Okay? So sugar, again, it's an indirect influencer of diabetes, but not the main root or the root cause of diabetes. The root cause of diabetes is, again, fat toxicity. Now, aside from her diet, aside from her nutrition with not much adherence to a plant-based diet, her exercise, her physical activity is actually quite good. She swims for 90 minutes twice a week. Although this swimming is just a very light or a very casual swim. So my plan for this patient is now as follows. So I asked her to continue taking her blood pressure medications. So instead of 10 milligrams of amlodipine previously, I lowered it down to 5 milligrams because of blood sugar improvement. I asked her to continue her Janomit, her anti-diabetes medication, just maintain on it. And I asked her to continue PPAR soft gel. Then afterwards, I further requested for more laboratory tests. No? So same laboratory tests like your complete blood count, fasting blood sugar, HbA1c, lipid profile, and calcium levels. Unfortunately, the patient did not follow up anymore. We're still waiting for news, no? When she will follow up. So if you're watching this, you know yourself. So please do, no? Don't forget to send us your laboratory results so we can make further recommendations. Now, let's go into diabetes as a risk factor for breast cancer. When it comes to prevention, the risk of breast cancer in women with type 2 diabetes was increased by 27%. So if you are a person with diabetes, your risk of developing breast cancer later on is 27% or is increased by 27% compared to the general population or compared to those who are not diabetic. Okay, so this is a very significant increase in your chances of developing one. Now, how does diabetes relate to breast cancer? cancer. So there are a number of pathways here, no, but mainly the insulin pathway. If for diabetic patients, since you have insulin resistance, so the function of insulin is blunted, so your pancreas will compensate for this. Your pancreas will produce more insulin so that blood sugar goes inside your cells. Now, for patients who have insulin resistance with working pancreas, typically insulin levels are very high. Very high insulin levels can promote growth of tumors. How were they able to make this observation? It's because patients who are injecting insulin, okay, exogenous insulin, okay, injecting insulin, they found out that compared to those individuals who are not injecting insulin, diabetic patients as well, no, who are not injecting insulin, they found that those who are injecting insulin actually has higher risks of cancer. This is one pathway, no, the insulin pathway. Another one would be the insulin-like growth factor 1 pathway. What is insulin-like growth factor 1? So this is also known as your IGF-1. IGF-1 is a growth hormone. So this growth hormone, the main function of this growth hormone is to make anything it touches grow. For adults, since we're not growing anymore, the only thing that grows inside us would be tumors, no? So if you have very high insulin-like growth factor 1 inside your body, then chances are you will have tumors. And how do we increase? What are the factors that increases insulin-like growth factor 1? Number 1 would be diet, the food that you're eating, specifically dairy, because casein inside dairy can stimulate the increase of IGF-1. Furthermore, the regulation of your sex hormones. However, for the regulation of endogenous sex hormones, no, this is actually something that is kind of like not within our control, because this one is or the regulation of sex hormones is actually really dependent on the age group. However, there is actually one effect, no, where we can control the amount of sex hormones that we have, which is sex hormone binding globulin. Now, sex hormone binding globulin, or SHBG. Now, SHBG is a protein that decreases when we are overweight. Now, SHBG is a protein. Okay, so imagine it to be like a glove. So this protein, sex hormone binding globulin, from its name, no, binds to sex hormones like your estrogen, your testosterone. Okay, so the more that you have it, the more that it will bind to estrogen. And if it binds to estrogen, the estrogen will not enact its effect on breast cancer. Okay, the problem here is for individuals who are overweight or obese, estrogen levels are really very high because fat tissue secretes estrogen. Now, if you have very high estrogen levels and you have very low sex hormone binding globulins, then your estrogen will enact its effect on the breast cancer cells. So breast cancer cells can now grow. Now, if you have very high sex hormone binding globulin, then this globulin will hold estrogen. So the estrogen will not enact its effect. Now, where can we see very high sex hormone binding globulins? Okay, individuals who are within the normal BMI. Okay, those individuals who are not overweight or obese. So number one, advice for those who are diabetic and for those who are those cancer patients who are overweight or obese, it's to lose weight. Okay, you have to lose weight. Just by losing weight, you significantly improve your odds against your fight against cancer. Another mechanism here is because of hyperglycemia, no, that could increase the risk of breast cancer, known as your Warburg effect. So this is the concept where we say that sugar feeds cancer cells. Okay, so this is very true, no? Cancer cells, their main fuel is glucose. And the more glucose you have, okay, the more fuel you give to cancer cells. And the problem here is cancer cells are actually very, very highly metabolic. So they consume and consume and consume without regulation. So the more sugar or the more fuel you have, the more you give to cancer cells. So this is also a very significant factor. And lastly, hyperglycemia or high blood sugar levels is associated with an increased insulin-like growth factor 1 as well, and other inflammatory markers. Okay, so this is another danger that we have to note of. So for diabetic patients who are cancer patients as well, very important, you have to be able to control your blood sugar levels and if possible reverse them. Here is how insulin resistance, no, or diabetes is related to cancer, no. So what happens in diabetes? If you have diabetes, you have insulin resistance. If you have insulin resistance, then tendency is you have high blood sugar, you have high insulin levels in your blood. Now, when you have high insulin levels, what will happen to cancer? It will stop cancer cell death. it will stimulate cancer cell growth. That's basically it. And lastly, having diabetes for at least 5 years, no, this can increase your risk of dying from breast cancer by 25%. And having diabetes is also a major risk factor for cardiovascular disease, and having heart disease can increase your risk of dying from breast cancer by 2 times. So everyone, the message here is control your blood sugar. If possible, reverse it. So that ends our webinar. Thank you, and we'll now answer whatever questions you have.
Now we know that the main culprit of diabetes is not sugar, but fat toxicity and the sweet connection of different diabetes pathways to breast cancer. Type them down on the comment section below. I can see a lot of questions coming up already. So let's start with the first question coming from Brain Lit okay. Is Simply Nature, what about goiter?
Yeah, okay, I'll take it on. Well, I've had patients who have had goiters, no? And of course, I used this product.
Goiter was the size of like a large baseball. It actually shrank. This patient actually had cancer. So but she was very concerned with the goiter because it's so obvious. So within actually less than a month, the goiter shrank significantly. By the time I saw her in person, her goiter, which she told me used to be the size of a baseball, was just a large lump at the side of her neck. And prior to that, we've always had testimonies, people sharing, clients writing in that it has helped with their goiters. But of course, I didn't get to see them in person. So this is the one that stuck in my mind because I saw this patient in person here in the Philippines, actually at one of the hospitals, natural hospitals over here.
Sorry, I was informed there was a technical problem with the sound. So can you hear us now? If you can hear us now, please type yes below. Okay, let's repeat the first question. Sorry. So from Brain Lit, Simply Nature, what about goiter, Do?
Yeah, Simply Nature PPARs can actually be effective for goiters as well. However, I have to know what kind of goiter you have because there are different kinds of goiters. Okay, so one patient of mine, actually, I presented this patient in one webinar. I think 2 weeks ago. Okay, so you can just go to YouTube and search for it, no? But this patient of mine have had thyroid cysts. Yeah, then we used Simply Nature PPARs. Then yeah, it shrank, no? So of course, with the help of a healthy lifestyle, we were able to do so. And upon biopsy, thankfully, the thyroid cyst was benign.
On my side, I've had many patients that actually shared that it worked for their goiter. The one that sticks out of my mind is the one that I saw physically here in person. So that patient actually had cancer, and one of her manifestation was there was a goiter on her neck, the size of I was told that it was the size bigger than a baseball. But by the time I saw her, her goiter was just a swollen lymph node. So it was a huge improvement, and this was under a month. She was at that time, because she's a cancer patient, she was actually using Simply Nature liquid extracts, and she had just finished her 1 box, which would mean that it was about 10 days, and she saw the fantastic results. So if you have goiters, do make an appointment with consult with Dr. Jansen because there is a good news on the line. It has worked for so many patients, and I pray that it will work for you too.
Thank you, Sir Shyan. Moving on to the next question from Facebook, from Chi Pifs from Kuwait. Is this product helpful for diabetic patient having pains in the feet at night?
Yes, definitely. The reason why you feel pain is because of the blood sugar. Okay. There's one pathway in diabetes wherein excess sugar is actually deposited into the nerves. And this is the one that causes the pain. Okay. So if you are able to reverse your diabetes, improve your blood sugar control, the pains would definitely go away as soon. Okay.
And to add to Dr. Jansen, we actually have had cases, plenty of cases where the person had to amputate their foot. So this is more advanced than the pain that you are experiencing. Right, Dr. Jansen, the pain they are experiencing is basically a diabetic neuropathy.
Yes, that's a peripheral neuropathy or diabetic neuropathy. Okay.
And so on the extreme case, we've saved many foot here in Southeast Asia due to diabetes. So the most extreme cases that I've seen is that the foot is actually gangrene has already started to set in. So that means amputation is not only the recommended choice, is actually quite urgent, because gangrene can actually cause death if it develops. However, what happened was that the doctor wanted to amputate just nice. The patient started taking the tablets, and literally within 3 days, the wounds, the color, started to come back, right? And they were able to save the foot. This is the extreme case of when gangrene set in. But when you have a case like this, I would really recommend that you go for a consult with Dr. Jansen. The beauty is that no matter where you are in Philippines, you don't have to rush down. With your mobile phone, the camera, you can actually show Dr. Jansen the thing, and we can quickly forward the tablets to you or soft gel if the thing is so serious, and you might be able to save the foot. I think that is priceless. That is priceless. Every limb is priceless.
If you can save the foot, right? So
if you can save the foot, you can walk normally. So that is something that I'm so glad that we can share.
There's actually, come to think of it, I'm thinking about it right now. What if we have a separate topic just addressing diabetic foot?
That could be interesting.
Yeah, because
Dr. Jansen, is pretty common. I've actually had when we first started, and we first started in Philippines with like naturopathic doctors. So apparently, I guess in the province, many people will go to naturopathic doctors. Perhaps it is less intimidating, more affordable as well. And sometimes, people don't want to go to a doctor when they know the solution is the doctor will ask them to amputate their foot. So but it was not really rare. It's quite common that people in that cases in Philippines, the diabetes gets so bad that they need to amputate the foot. That was quite surprising for me, that a patient would allow it to reach that point. So to every viewer tonight, the good news is you don't have to let it reach that point. It could be easily preempted, right? And if your foot is already changing color and you're really worried, have a consult with Dr. Jansen. Like I said, now with the mobile phone, you can just use the camera and he can actually see your foot, right? Yeah. So you can do this and get the answer from the comfort of your home, right? Yeah.
She actually has a follow-up question. What product is good for me to stop my feet pain? Also, at middle of the night, my legs cramps.
I have to know why. Okay, there are a lot of reasons why. It can be related to diabetes. It can also be not totally related to diabetes. So at this point, I cannot just recommend a product because I have to know what is the cause of the pain. Okay, but on the get-go, just to have some value from this, okay, immediately you have to eat right. Okay, go plant-based. it will do a lot. Okay, it can do a lot of benefit on the get-go. Okay? Yeah.
Uh,
Yeah, so go,
Yeah,
sir.
I would also recommend that if you are going to make a consult with Doc Johnson, do it immediately. One thing you can do, which I am very sure, no matter what, Doc Johnson will always include, because you're diabetic, at least the tablets. So you can try and get the tablets first if you can't have a consult immediately tomorrow, for example. So that's my recommendation.
Okay, so for those of you who wish to have a consult with Dr. Jansen Galalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist vet will reach out to you shortly. Our next question coming from Miss Emeline Kageyama. Doc, how long should a fourth stage lung cancer will take PPARs? Thank you.
Really depends. Stage 4 lung cancer is pretty advanced. I'm also not quite sure if it will still be effective in terms of reversing the cancer. No, however, for stage 4 lung cancer, the protocol that I usually give is liquid. Okay, how long should you be taking the liquid? It's for at least 6 months. That's more or less a pretty good gauge already whether or not you'll be responsive or not. Okay. However, having said this, I don't only use liquid in treating stage 4 lung cancer. I also use other modalities. Okay. So the other modalities would depend on what symptoms you're experiencing, the status of your body. So it would be better to go for a consult actually so that I can make the proper recommendations. But speaking of the PPARS protocol alone, okay, at this point we really have to go at the highest concentration, the strongest one, which is PPARS liquid, then see where it goes from there. Okay, so sometimes it's not just 6 months, it can be more than 6 months. Really depends on how you respond.
I also wanted to add, another consideration for most cancer patients is the cost. This is something that I guess on this show, we just want to be upfront that it's one of the most stressful aspects of cancer. It's not only the treatment, it is really the cost of treatment. I've sat outside doctors' clinics, oncologist clinics so many times while waiting to meet up and connect with them, that there will be actually, I will hear people on the phone saying, Tito, it's going to cost 5 million, 3 million, something like that. And they look so stressed. So I just want to share with everyone that here on our program and also at Simply Nature, and I'm sure with Dr. Johnson's SMG as well, that we are here to also help you with the financial aspect of the protocol. So I just want you to be frank when you are speaking to Dr. Johnson and his team, with my team, when you're inquiring about protocols, right? Because do not step away or do nothing because you thought that you could not afford, right? There will always be an affordable protocol. It may not be the ideal protocol, but it would still be a protocol that can help you. So I think for every cancer patient, rest assured, you can try to do something to have an impact on your fight for cancer. And that's what I wanted to share, that, if you have some financial difficulties, let Dr. Johnson's team know, let my team know what's your budget that can work for you. And we might be able to come up with a protocol that gives you the best shot that you can get. Right, Doc? I mean, I'm sure with so many cancer patients, sometimes finance is always an issue.
Yes, it always is, no? 90% of the time, finance is always an issue. Whether or not you're going for whatever protocol, be it chemotherapy, radiation, surgery, or whatever, it's always so expensive. So the good thing here is with conventional medicine, with conventional medicine, unfortunately, the protocols that they give, on the oncologists are very rigid. it's very difficult. It cannot be modified, okay, because you risk the efficacy going down. However, with the other ones, like the protocols that I use, we can adjust. Okay. However, of course, be always keep this in mind, no? Don't just focus on one mode of therapy or one mode of treatment. Always use multimodalities, multiple kinds of therapies, because usually if you utilize multiple different kinds of treatment or therapies, it's always more effective compared to just one. Okay, so I'll give you an example. Okay, if it's applicable to you, surgery with chemotherapy would definitely be more effective than surgery alone or chemotherapy alone. Okay, so the same thing applies with the natural treatments, lifestyle interventions, food, or whatever other treatment modalities that you are considering. Okay, it's just that you have to, of course, ask your doctor whether or not these treatment modalities might have interactions. Because I'll give you an example. No, some treatment modalities that utilizes antioxidants can interfere with radiation therapy. So because radiation therapy utilizes oxidation, okay, so that can interfere. So that's just one example. So there's some scheduling that has to be done. Okay, definitely. However, it's just that consider all treatment modalities that is applicable for you to get the most favorable outcome for your cancer treatment. Okay.
Thank you, Doc. Thank you, Sir Sean. Our next question coming from Facebook, Miss Maggie Gallardo Ninobla. What about visceral fat, Doc? Many women with normal BMI have abdominal obesity. Is it a risk factor for diabetes?
Yes. Even if you have normal body mass index, normal BMI, if the fat content inside your body is high and you eat a lot, then yeah, definitely you can develop diabetes as well. I have one family member actually. He's thin, even thinner than me, but he's diabetic. Okay, he's taking medications. So yeah, even if you have normal BMI, if you are eating so much, fat content, visceral fat content especially, no, is very high. You have a what we call a beer belly. Okay, so yes, that can definitely lead to diabetes, or at least increase your risk of developing diabetes later on. Okay.
You know,
Okay.
Doc, on this waistline thing in Taiwan, the government actually, the Ministry of Health of Taiwan actually ran a television ad campaign. I think it was as long as you are greater than 32 inches, for women or for guy, I can't remember. You are at risk of the three highs. All right, in Taiwan they call san gao, which is the three highs: high blood cholesterol, high blood pressure, and high blood sugar.
Yes.
Just by the
Correct.
waistline alone, you know. So it doesn't matter if your BMI is good or bad, because as long as your waistline is across, your risk factor just skyrockets. So yeah, it's time to look good. Okay, that's another encouragement. If you manage your waistline, you look good as well.
That's true. Okay, moving on to next question from Facebook, Miss Luz Caringal. Is this also helpful for hands numbness? I experience burning sensation at night with my right hand.
Yeah, that sensation that you're feeling is also peripheral neuropathy. If you have diabetes, then that would explain it. Okay, that is treatable, can be reversed. Okay, so better go for a consult. Okay, yeah.
Okay, next question coming from Miss Alice Buenafe. I am a breast cancer survivor, but my health concern is rheumatoid arthritis. Can PPARs help me with knee pain?
Yes, I actually last week, just last week, right? Yeah, we have a rheumatoid arthritis topic. However, this patient of mine is not a breast cancer patient, just rheumatoid arthritis. So definitely, yes, no? Rheumatoid arthritis is rooted, the pain that you're feeling is because of the bone degradation that's happening, because of the inflammation inflicted by your immune system. Okay, so we need to have some medications for that to address that and also to counteract the inflammation. For the inflammation, Simply Nature PPARS is very effective because it's very concentrated with antioxidants and anti-inflammatory nutrients. Okay, so yeah,
Doc, I think
definitely yes.
Doc, I think some of our newer viewers might be kind of surprised. How come every disease that we ask, they ask, the answer is the same? It's always the protocols. It almost sounds like selling or recommending magic pill, right?
Yes, yes. Sometimes it's when you hear about it's too good to be true because it's one solution for everything, for every illness. The thing is here, lifestyle diseases, metabolic diseases, cancer. Okay, when I say lifestyle diseases, that would be the top 5 causes of death in the Philippines. Okay, so your heart disease, that would include a heart attack, stroke. Okay, number 2, cancer. You have your hypertension, you have your diabetes. I mentioned already, stroke and heart attack. No, so the top 5 are all rooted in inflammation. Okay, and it's all lifestyle. It's rooted with the food that you eat. Okay, and its onset is because of the inflammation. And since we have a product that's good for inflammation, so that product would be effective for these diseases. Okay, so actually these 5 have commonalities. Okay, number 1, physical inactivity, poor diet. If you have vices, all of those can contribute to developing these 5. Okay, so there you have it. So if you think about it, the risk factors for developing each and every one of those diseases are actually common. And the good thing is, with Simply Nature PPARS, the product is actually good in addressing the root cause of the risk factors of these diseases. That's why, for this, it's really effective. However, please take note, there are a lot of diseases where the product won't be applicable. Okay, so it's not a one size fits all product.
Yeah,
okay?
it's not a one size fits all. However, in our programs, because of the commonality, all these diseases actually start from the same root source. That's why the solution can also be one. So as Dr. Jansen mentioned, because my area of interest and specialization is more on like PPARS, is this. That we know that PPARS actually works on 4 pathways. So it's inflammation, it's immune response, okay, it's cell delineation, which is how your cells mature, all right, and the last one is metabolic pathways. Okay, so because of that, the diseases that often come up in our program are one or more of these root causes. Right. I remember, Doc, the most surprising one was when one of our doctors, and this wonderful doctor, Dr. Maribel, I think you might have met her before. Yeah, she's a pediatric neurologist. She actually used our product for schizophrenia, and even for myself, our company has never even thought about using our product for schizophrenia. That's a brain or mental disorder, as a brain disorder. So I said to Doc Maribel, why did you even think about using Simply Nature soft gel extracts in this case for your brain disorder patient? And she told me, Shen, almost all, not all, but almost all brain disorders, one of the causes is neural inflammation or inflammation in your brain. So I thought that if your product deals with inflammation, it might help with this aspect of the brain disorder. And true enough, Simply Nature PPARS was used on one of a schizophrenia patient. It didn't help, it didn't cure her of her schizophrenia, but it allowed the patient to calm down without using psychotropic drugs. So that in itself is a huge advantage over constant use of many psychotropic drugs. So again, this is just to go back to the topic that we're talking about. It may seem like, are we being lazy? How come every disease is using the same protocol, but it's really because of the root cause. So I hope that me and Dr. Jansen's little explanation today will help you understand how come from breast cancer to brain disorders to your numbness in your hands to your feet getting gangrene, we are always recommending these basic protocols because the root cause is the same. However, for specific diseases like leukemia, for red blood cell, white blood cell count dropping because you're going for chemotherapy, there are specific mechanisms of action that actually helps explain or why it works. Our product works for chemotherapy, for the to increase the red blood cell count and the white blood cell count when you are going through chemotherapy, right? So that has specific functions, which just go and look at our older webinars. You'll be able to see them. But tonight, the questions that came out is because they have common causes.
Yes, so to keep yourselves updated with our latest online events and promos, please don't forget to like our FB page, follow us on Instagram, and subscribe to our YouTube channel to replay and share with your family and friends our very informational weekly webinars and very inspirational success stories. We actually have a question coming from YouTube from Miss Ivags. Hello, host, where we could buy PPARs?
Okay, someone will get to you as soon as possible, but you can actually go to simplynature.asia for international clients. We ship globally. So that's the answer for that. For those of you who are in Philippines and those of you in Singapore, you can go to Lazada Singapore or Lazada Philippines, Lazada Mall Philippines, okay? We sell only through official malls so that we don't have resellers. So you can only get directly from us or from your doctor. Or have a consult with Dr. Jansen and his team can also supply you our protocols.
That's correct. So next question coming from Miss Evelyn Kageyama. Doc, I'm very active and my onco said that the cancer shrunk already, but the thing is I'm afraid for the recurrence.
Yeah, what's the question?
Okay, I know
Cancer
the question.
recurrence.
I have the question.
Okay.
I have the answer. So, Emily, number one, congratulations. I know. I hope your success is an encouragement to everyone that is watching tonight. All the cancer patients. It's always very encouraging when we hear someone doing well. And that could be you too, okay? So, Emmeline, I read further up that you also took 1 jar of PPARs already. So I'm so glad that your combination of onco and PPARs and you're still watching this program. So I think you're looking for more solutions. I think your approach is really good. I want to recommend one thing. I want to recommend that you actually form a relationship with Dr. Jansen. Okay? Not a romantic one, okay? Just something like what you're going through. You will notice that for the cancer journey, right, for a cancer patient, you will go through many specialists. You might start with you may start with a surgeon, then you go who will do the surgical removal of your tumor. Then later you go to an oncologist, medical oncologist, who will then administrate chemotherapy with you. Once your tumor is clear and you're gone, all right, then I am sure your onco will introduce to you the hospital's cancer center, and they will try to assign you a nutritionist. Do you notice something? You are moving from one doctor to another specialist, and no one is actually looking at your whole journey. And how long is this journey? This journey is 5 years. And so you want one doctor who knows your condition, what you went through during surgery, when you were going through chemotherapy, when you had trouble during the chemotherapy, what did you do to overcome those challenges? When did you go into remission? How are you doing? How's your blood sugar throughout the whole process? Were there other symptoms that came along that you couldn't focus on while you're going through chemotherapy, but now that you are in remission, you can focus on that, and how to prevent recurrence. So you notice the journey is pretty long, right? And you keep moving from doctor to doctor to doctor. No one has a clear picture. So I would like to recommend to Emmeline that why don't you form a long-term relationship with Dr. Jansen? I'm almost like a matchmaker. Okay, no, but I'm serious right now, right? The point is that so that you have one doctor who will know the whole journey. And this is something that your onco cannot do for you because his specialty is that chemotherapy and immunotherapy, just like the surgeon's specialty is surgical. Dr. Jansen's specialty is to actually help you through the whole process. That's why he knows surgery, but he doesn't perform it. He's not a surgeon. That's why he knows chemotherapy, but he's not an oncologist, so he doesn't administer the drugs. But he understands all the steps in your entire journey for cancer. Won't you feel more confident that there is someone with you from the start to the victory celebration of your journey? So Doc, her question is, what can she do so that she doesn't have recurrence?
Well, to prevent recurrence, what the strategy is to prevent the strategy for preventing cancer in the first place is the strategy to prevent it from recurring again. Okay, so number one would be to look into your lifestyle, the food that you're eating. Are you exercising? Are you sleeping? You said that you're active. How active? Okay, because there's a minimum amount of exercise required to sufficiently say that you're, active and you're getting the health benefits. Okay, the food that you're eating. This is where a lot of gray area is happening. Okay, because one doctor will say that eat this way, another one will tell you no, eat this way, eat this food, eat this food. So it's all very confusing. I've looked into the different diets already, and there's one, okay, that gives you the most benefit, and it's a plant-based diet. Okay, so aside from that, are you sleeping well? So aside from your lifestyle, did you finish your treatment? What supplements are you taking? These things have to be taken into consideration. But from the get-go, without consulting, without getting anything, without purchasing anything, the number one thing that you can do is change your lifestyle. So what you can follow is plant-based diet, exercise, and sleep well. Okay. The other modalities that we can utilize to prevent recurrence, I have to talk to you already. Okay. So I can make the appropriate recommendation because I don't know your history. So, and what kind of, procedures you have had previously. Okay. So yeah, there you have it.
I think we all have to persuade Dr. Jansen to write a book on the cancer journey. All right. So that we have a good guideline on what to do. I mean, thank you so much, Emlyn, for your question. It's such a great question. We've met so many cancer patients who are in tears because they were declared cancer-free 6 months ago, and suddenly they were told that their cancer came back and it's now in the brain, in the lungs, in the bones. So this is something that's always so stressful. So we truly understand your fear of recurrence, and you are very, very wise. I want to say, Emlyn, you're very, very wise because the recurrence rate for cancers across the board is actually not low. It is pretty high, like 30% for many cancers. So that's like 1 in 3 chance. 1 in 3 cancer patients actually have recurrences. In Singapore, our insurance for cancer actually is normal. The normal coverage is actually for 2 occurrences. So that means when a patient gets cancer, the insurance company expects you to get it a second time. All right. So that's how common it actually is. And it is also very true, Emlyn, that when the cancer comes back, survival of a recurring cancer is much, much lower. It is a lot more fatal because the cancer is most likely immune to the treatment that you first used to beat it. So the second time it comes, you cannot use the same chemotherapy drugs anymore because the cancer has adapted and mutated to deal with those drugs that you used the first time. So again, all this just means that there should be a plan. There should be a plan on what to do after your chemotherapy is successful, after the onco declares you clear and he releases you from his care. Who's going to care for you next? There's got to be a plan to prevent recurrence. So again, I would like to encourage all cancer patients, and if you have loved ones who are beginning their journey, in the middle of their journey, and you think it's a great idea, I really encourage you to have a consult with a doctor like Dr. Jansen, or if you really like Dr. Jansen, make a consult with him and let him be able to walk with your loved ones or yourself through this entire journey.
Okay, just a quick poll question at the bottom of your screen. You can see how did you find out about us? Did you hear us from your doctor, your friend, or you saw a Facebook ad, or you watched our YouTube video? So don't forget to answer that before our webinar ends. And moving on to the next question from Miss Sunshine Lee. I am a stroke survivor and diabetic. Can PPARs help?
Yes, definitely. Stroke. Well, okay. Here's the thing, no. Okay. I think we have other questions that's related to this. Okay. So we save time. If your disease is cardiovascular, meaning it's heart, it's brain. Okay, because for the brain, it's still vascular. Okay, so cerebrovascular, it's cardiovascular. So meaning related to the heart, related to the brain, PPARs will be effective. Okay, if it's metabolic, number two. By metabolic, it means that you might have a problem with your blood sugar. Okay, so you're diabetic, you have high blood cholesterol, you have high triglycerides, you have fatty liver, you have thyroid problems, you are overweight or obese. This will work. Okay. What else? Cancer, of course, we're discussing cancer. So yes, it can help cancer patients as well, especially when you're undergoing chemotherapy. Radiation therapy and the others, no. What else? Pain. Okay, you have arthritis. May it be autoimmune in origin, can be because of uric acid. Okay, gout. That's another metabolic issue. If you have osteoarthritis, PPARs can help as well. Okay, however, having said that, we still need to use other modalities. Okay, some modalities that we can consider would be ozone therapy, prolozone. Okay, that's very effective for arthritis. Okay, and others. Okay, so if you belong to one of the diseases that they have mentioned, yeah, PPARs can help. Okay, yeah.
Sir Shan, would you like to add anything?
No, I think Dr. Jansen covered everything. And it's so good that we talked about this tonight. You know, normally we are very specific. Our topics are very specific, and our questions are also very specific. However, tonight we have questions all the way from diabetes to breast cancer to undefined hand leg pain, right? So these things are very broad. And to our viewers, they might be wondering, how come one protocol can do so much? Yes, and at least now they understand. And a simpler explanation is also that, you know, just eating a lot of processed food, one thing can create so many diseases too. So the reverse is also true. Yeah.
Yes.
Okay, so let me read the next question from Miss Mini Gamab Concepcion from Batangas City. I got pain for almost a month in my left thigh and numbness going down to my legs, just the left and facing outside only. The pain is start once I start to walk when I get up from bed.
Yeah, that's sciatica. So you might have a spine problem. Okay. So in this case, if it's just a spine problem, okay, it's sciatica per se. PPARs will not work. Okay. Because the problem is anatomic. You have a problem in your spine. Okay. So my suggestion is go see your orthopedic doctor. Okay. And of course, you can also see me for pain management. Okay. So we can do something about the sciatica that you're feeling. Okay. So yeah, there you have it.
Okay,
Oh.
I just go
Yeah, I
Shyan.
just wanted to add that, you know, please do something. All right. Yeah, I think this is really important when we come for a program like this, is to take some action. Of course, if you are, like for this particular patient, if you are worried to go and see an orthopedic, I just want to tell you, I'm not sure where you're from. So I've met many people from many different walks of life. Some people are very comfortable to see a specialist. People like my sister who are a bit hypochondriac, which means that they think every little symptom is a serious disease. She does not hesitate to send my mom or her kids to specialists. But going to see specialists can be expensive. So on the other spectrum, some people are kind of scared when they and someone tells them, I think you have to see a specialist. Okay. And you might be, oh my God, is that going to cost a lot of money? So I'm not sure on which spectrum you are at, but I just want to encourage you, you've got to do something. Don't ignore it, because just like cancer, many things at the beginning can be treated very inexpensively, very cheaply, and very simply without a lot of pain. Don't allow your body to reach the point where the disease gets serious. Then the cost gets very serious. The discomfort and pain and suffering you go through is also very serious. Now, if you're in doubt or you're not sure whether you should commit to go and see a specialist, then I would again encourage you to have a deeper personal conversation with Dr. Jansen, provide more information where he's able to interact with you. Then you can probably have a clearer picture of what kind of specialist, if you have to see a specialist, or you can just start with a recommended doctor from Dr. Jansen. So I think the important thing here is to take action now that you know there might be something a little bit more serious that's coming from your very simple symptoms. Again, don't scare yourself. So maybe you can start with a consult with Dr. Jansen, and then after you tell him more details, he's like, okay. With the more details, you just have something very simple, just exercise a little bit, watch what you eat, maybe take some simple protocols, and then you are fine.
Okay,
Whatever you do, don't do nothing, okay?
Ayun. So let me greet our viewers. Miss Almalin Salvilla, watching from Camp Navarro General Hospital, Zamboanga City. And Miss Janessa Santos. And Miss Malu, watching from Cavite. Miss Hermosa, watching from Taytay, Rizal. And Miss Catalina, watching from Libertad, Kabukgayan, Biliran. Okay, good evening and welcome to the program. Our next question, Miss Lisa Garrido Lontok. Is the product also good for thyroid nodules and gallstones?
Thyroid nodules, yes. Gallstones, no. Okay. The gallstones is a different issue. Okay. Sometimes it can be very difficult to dissolve the gallstone, so you need medication for that, specific medication, which is ursodeoxycholic acid. No, so that's a bile salt. Okay, so you need to dissolve it that way. However, for that matter, since gallstones can be cholesterol stones, can also be uric acid stones. The reason why it forms in the first place is because of high uric acid or high cholesterol. So for those two, PPARs can work. Okay. However, sometimes even when your cholesterol and uric acid is controlled already, the stone will still be there. So you need other modalities to dissolve them. So one would be the medication that I just mentioned. Okay, if it's not effective still after 1 year of treatment, then if it's painful, then surgery has to be done already. Okay.
Oh, okay. Miss Janessa actually has a question. Good evening. I am 80 years old and my blood sugar is 9.8. What can I do?
Go for a consult. Okay, since you're 80 years old, I cannot just mention some things that because I need to know why your blood sugar is so high. Okay, and I need to know what medications you're presently taking, how long since you've had your latest blood works. So these things have to come into play so I can make the proper recommendation. But from here on out, to lower your blood sugar, make sure that you're eating healthy. Okay, if you're not, okay, so what would that be? Again, plant-based diet. Make sure it's natural, it's fresh. Okay, minimize oil, limit oil. Don't eat too much oily foods or fatty foods. And then I think that's about it. No, exercise. I wouldn't recommend too vigorous exercise. Light exercise would be enough since you're 80 years old. Okay, and of course, a plant-based diet. I understand that it's very strict. So we have to also consider your age. Since you're 80 years old, of course, you have to enjoy life. If food is a pleasure for you, then we also have to consider that. So everything has to come into play. Okay. So go for a consult. Yeah. Okay.
Okay, thank you, Doc. Next question coming from Miss Cora Alba. How about PCOS and migraine? Can PPARs help? Tablet or what kind of PPARs?
Doc, let me
Yes.
take this first, then you go for
Okay.
it.
Okay.
I just want to encourage this viewer because when we were doing medical conference at Prima, all right, one doctor, a very prominent doctor, actually stood up because this question was brought up. The doctor actually stood up. I'm not going to mention his name because I didn't ask him for permission. But he had a very prominent doctor from Metro Manila who is one of the top endocrinologists in Metro Manila. He actually stood up and answered the question on my behalf, even though the question was, because he was so excited, he stood up and he said that he confirms that the protocol is very effective for PCOS. And he specifically uses Simply Nature soft gel capsules. Okay, I don't know what is the dosage that he gives for PCOS. I guess it also depends on the exact status of the PCOS. But yeah, now I'll hand the answer back to Dr. Jansen, who will probably talk about the dosage or something like that. Okay.
Yeah. Yes, the answer is yes, it is effective. Okay, so PPAR agonists, how? Simply Nature PPARs is an insulin sensitizer. Okay. One problem of PCOS is insulin resistance. Okay. So we're getting at, no?
Okay.
So sometimes PCOS, patients who have PCOS can have high blood sugar, okay, because of this. Okay, so definitely PPAR agonists will help. Okay. For the other one, migraine is again rooted with inflammation. I'm sorry, I did not mention this, but it's rooted in inflammation. So PPARs can definitely help because it's again anti-inflammatory in nature. Okay, it activates your genes that promotes or activates the antioxidant pathways inside your body. That's why it's so effective because it works at the genetic level. Okay, so yeah, there you have it.
Now I want to ask you because for migraine, many patients actually share dietary fiber like cleansing plus actually works for migraine. Could you explain or illuminate this reason?
Yes. It has something to do with the gut microbiome. Okay. The gut is actually considered as the next biggest nervous system. Okay. It has a lot of nerves there. Okay. So in one pathway, no, that produces this effect, no, the resolution of migraine through dietary fiber is fiber. Us humans cannot digest fiber. Okay. How do we then process fiber? Our gut microbiome helps us process the fiber. Okay, so when the gut microbiome processes the fiber or metabolizes the fiber, short chain fatty acids gets produced like butyrate, and the short chain fatty acids has anti-inflammatory properties. It can also promote the production of serotonin. So serotonin is the feel-good hormone. Okay, so this is one mechanism on how it resolves the migraine, okay, because of the anti-inflammatory properties that gets produced, the neurotransmitters that gets produced in the process. So definitely, we have two major factors in play here. Dietary fiber and your gut microbiome. The problem here is, okay, well, dietary fiber is dietary fiber. It's just a matter of whether you eat vegetables, plant foods, or not. Okay? The other one is the gut microbiome. Okay, the gut microbiome can change. Okay, the population of your gut microbiome can change. So sometimes when you eat dietary fiber or your gut microbiome is set up in a way that produces neurotransmitters that produces migraine. Okay, it can happen this way. So you have to change your diet into a healthy one so that the gut microbiome can adapt, can change so that the neurotransmitters that gets produced will also change so that you don't produce migraines anymore or you don't have migraines anymore. Okay, so this is how it works basically. Okay, so the most important here is dietary fiber. Okay.
Yeah. That's really interesting. If you have dietary fiber, you go poop regularly, your migraine actually diminishes. This one I have personal understanding because my sister-in-law actually suffers from chronic migraine. And when she started taking cleanse, and you can take any dietary fiber, right? So whatever dietary fiber you like, take it. If it doesn't work for you, then try Simply Nature's cleanse, okay? But anyway, when she started taking dietary fiber through our cleanse, her migraine occurrence, the rates just dropped, right? So one common understanding a normal person has, doc, not so technical like yours with the serotonin. They thought that because my sister-in-law is also constipated. So their idea was that because they're constipated, the toxins build up in their body, and then that causes the migraine. Actually, is there some truth in that very simple thought process?
Well,
We
that is how a
understand.
doctor, yeah, that's how a doctor would explain to the patient because of
Okay.
the toxins. Yeah,
Oh,
but the actual mechanism is not that simple.
all right. Okay, so for all of us who can't follow Doc Jansen's more technical explanation, the toxins building up and affecting your brain, giving you a headache would suffice. So if you get rid of your constipation, you start removing toxins from your body, your migraines occurrence should diminish.
Okay, connected to that is actually another interesting question from Miss Han Yuri. If you have a breast lump and you have decided to take PPARs as an intervention, you claim it's going to be dissolved. So where is going to be the point of exit? Will it rupture the skin? Will it be mixed in the blood or excrete as poop?
No, okay,
Interesting
here's how
question.
the body will remove it, no? It actually reabsorbs it. I think that's the best word to describe it. Yeah, I think it's the best word to describe it. Reabsorbs it. If you study biology, okay, you have your breast tissue, right? If you look at it under the microscope, there would be cells lumped together. So with cancer, you have abnormal cells in a sea of normal cells. Okay, so when the tumor gets dissolved, okay, or when the tumor gets like for example, you underwent chemotherapy, the tumor went away, right? So it's basically the abnormal cells dying. When the cells die, the healthy cells consume them and breaks them down. So that's the scientific yeah,
Like
it's the science
fertilizers.
behind it. Yeah, it's the science behind it. However, the best word to describe it is that it reabsorbs them. Yeah, the body absorbs it. Yeah, so basically it breaks them down. The dead cells gets broken down. How does it gets broken down? The chemotherapy will bombard, or whatever therapy you use will bombard it. When the cells die, it would be yeah, it would be burst. No, it would be it's dead, right? So with the cellular debris, the debris will be eaten by your healthy cells and be further broken down. Okay, so that's how it happens.
I think Jen's analogy is quite it's not technically accurate, but it's in essence it's pretty accurate. Your tumor cells become fertilizers for the new cells.
In a way, yeah, in a
They
way,
became the raw
yes.
material, being reabsorbed and being reused to create new cells.
Yep.
That's actually why our body is so efficient, or else you'll be eating a lot more than you actually are. And that's one reason why you don't need to eat so much. Okay, because the body does break down the old material and then reuse it. All right. Yeah. Okay. So that's one good reason not to eat too much.
Okay, next question coming from Miss Malu Cascaño Reyes. Good evening. I had left mastectomy by July 8 and then follow-up checkup by July 17, Monday. I don't know if I'll be advised for chemo or radiation, but if ever they will advise me for chemotherapy, I don't want to undergo chemo. I have stage 2 breast cancer, so can PPARs help me? Thank you.
Yes. However, please don't be discouraged because even if your onco recommends you chemotherapy, PPARs can help mitigate the side effects. So yeah, you can take both actually. No problem. Yeah. Okay. I actually suggest you take both.
Um, for the patient that is asking this question, me and Dr. Jansen were looking at some survivor data, which is very surprising to us. It showed us that cancer patients who got well without going through chemotherapy, actually their cancer came back earlier in their life than those who did chemotherapy. I guess, Dr. Jansen, we don't really have the full details on how I don't know whether this data is skewed or not, but when me and Dr. Jansen were talking about why is that the case, we were guessing that, so everybody understand, how does recurrence work, okay? How does the cancer come back? It's very unlikely that you will kill every single one of the cancer cells that caused you cancer this time round. Okay. However, it takes a long time for the cancer cell to grow back, right? So if it took you 15, 20 years to develop cancer, it will take another 15, 20 years for that same small cancer cell to grow back to become cancer. Okay, so the idea is, if you can destroy as much of these cancer cells as possible, then it will take such a long time for this remaining cancer cells to come back. So if you are 40 years old and you destroy it very thoroughly, it may take another, 30, 40 years for that cancer to come back. By that time, yeah, you have already lived your life. So that is a reason why the cancer never came back in your life, right? Because you did it. So that's the reason, why oncos, let's say you do your surgery, everything's clear. You'll be thinking, Doc, I'm clear. Why are you prescribing chemotherapy to me? The reason is because no matter how clear you are, there is a high chance that the cancer cell, which is now too small, is no longer a tumor, right? But there is still that cancer cell circulating around in your system, but it's too small to be detected. You will have to wait some time before it grows big enough for it to be detected. So as a preventive measure, since the oncos know it's highly possible that those cells are in your body, that they will ask you to do chemotherapy that basically bombs every single part of your body, all right? To just kill as much cancer cells as it possibly can. So of course, you'll be damaging the good cells in your body as well, right? So is it necessary to damage your good cells in your body? If you did not have Simply Nature PPARs, then the answer is no, right? Because you might damage the immune system as well, and then that will allow the cancer cell to come back. But if you have Simply Nature PPARs extracts, it will protect your healthy cells during the chemotherapy, right? So then it really makes the chemotherapy then it makes more sense. It is something that you can really consider. So maybe other factors that will help you decide whether you want to go for the chemotherapy or not is cancer part of your family history, right? If it's part of your family history, then you might want to be very thorough in your cancer treatment. So again, maybe a consult with Dr. Jansen will help you. And since, so on Monday, you get the results, whatever the doctor recommends. If you're not sure, go and see Dr. Jansen. And then feel free to ask Dr. Jansen many, many, many questions, all right? And if he doesn't answer all your questions, next Thursday, ask him again on the show. All right, yeah. So I think this is the thing. Be confident, be comfortable to ask questions. It is your body, it is your health. But when your doctor, like Dr. Jansen or us, when we give you an answer that you don't like, don't switch us off and cancel us, okay? Don't do that. Instead, ask us, why, doc? Why would I don't like chemotherapy? I'm cancer-free. Why would you recommend chemotherapy? Ask, because we have good reasons to recommend you that. And I won't take up too much time. Go for a private consult with Dr. Jansen. after your results come back on Monday, and depending on what your onco suggests, okay? Now, if your onco doesn't even suggest chemotherapy, then you are clear that, hallelujah. Then see Doc Jansen for the right protocol to keep yourself cancer-free.
So we're almost at the end of the webinar. I think this will be our last question for tonight from Miss Han Yuri. Why is natural medicines not allowed when you are undergoing chemotherapy? Are there any contraindications?
Not really, not really. Natural treatment is the food that you're eating, your lifestyle basically. Even with food supplements, right? That would also be under the realm of natural treatment, right? Because food supplements are made from food. Okay, so why wouldn't be contraindicated when you're undergoing chemotherapy? Okay, so it's not. I think it will be better for you to use both, no? As long as what's important here is make sure there's no interaction, okay? Because there are certain kinds of chemotherapy where the chemotherapy uses inflammation. And when you eat antioxidants, that will counteract, okay? So it's just a mixture on how you administer both. However, since you need to eat, right? I mean, okay. So yeah, that is under the realm of natural treatment. So it's not yeah, both should be done together. Yeah. Okay. Yeah.
Jen, I see a last question by
Yes.
and Maggie has asked so many good questions tonight. So I just wanted to answer her last question. Could you read it out for us?
Okay. So last question from Miss Maggie Gallardo Ninobla. Do you have data or evidence available to support the product's effectiveness? I mean, do you have enough testimonials?
All right. For Maggie, the answer is yes on all counts. Okay. Since we're at the end of the program, I will share with you how you can access this data. Please go to Simply Nature International YouTube page. There is that in the YouTube page, you will see different classifications of videos. There's actually a series of videos that are called Doctor Forum videos. These are the videos of our conferences, not Facebook Live, because these are closed door sessions. These are doctors' forums, which means the people that are attending those closed door conferences are all medical doctors. So in those programs, we go into the evidence, we go into the mechanism of action. They get slightly more complicated than what we have here, because here we try to make it something that is relatable, you know, because we know so many patients, when they see their onco, they come out just as confused because of the medical terms, so it doesn't help the patient. So here we try to bring things in a way that's more relatable, more layman. But in those doctor forums, it's more technical. So if you're inclined, you're looking for the evidence that will give you the confidence, please go to Simply Nature International YouTube channel and then take a look at the videos. Go under doctor forums. Okay, these are forums designed for doctors. So there you get your technical answer. But right now, I'm gonna take a strategy from Dr. Jansen's playbook, which is, let me give you something as you so that you can take away straight away. All right, I want to help you understand how do we go about doing our research and publishing our evidence. Okay, number one, our products are natural, which means we didn't design it. So for designer drugs, for drugs, you know what you want, then you design the drug to do what you want. All right. For nature is not. For nature is, we ate the thing. Oh wow, so many people did well with this. So let's take a look. How does it work, right? So for example, when sailors discovered that by eating key limes, they could stave off scurvy. They don't know how it worked. They just noticed that when you eat lemons, you don't get scurvy. It's many years later when they try to understand how come if you eat lemons, you don't get scurvy when you are sailing on the ship. Okay, so that's how Simply Nature's products, how we focus our research. Okay, we've been around for for a long time, more than 40 years. And in the beginning, people were just eating our unique microalgae for general health, all right, for general health. We don't focus on a lot on that, but actually Simply Nature tablets are superfoods. It's great for your kids, for everyone to take. It's just the most powerful, it's just the best multivite you can ever take, and it's all natural. Then what we notice is that, wow, a lot of our people who take our products, their diabetes and their blood cholesterol improve. Now, we wanted to find out why. That's when we got the National Health Research Institute of Taiwan, the Ministry of Health in Taiwan, got involved, and we tried to understand why our product helps diabetic patients and high blood cholesterol patients. Then we discovered we had PPAR agonists. It doesn't exist in other algae like chlorella and spirulina, but it exists in our unique strain, right? So then we say, oh, wow, we have PPAR agonists. So then we started to go and take a look, what does PPAR agonists do? Now and thank God, the pharmaceutical companies are researching PPAR agonists for their drugs. So our mechanism, we work in the same way, but we don't have the side effects of the synthetic, like the artificial ligand that is created by pharmaceuticals. Ours was a natural ligand. Now, as we did that over the years, we started to, once we knew that we had this effect, more and more cancer patients start taking our product. So then we started to ask ourselves, okay, what does, would our product have, how does it work with chemotherapy? So we asked ourselves this question, and then we tested our extracts with chemotherapy drugs, cisplatin and oxaliplatin, which are the most commonly used drugs in chemotherapy. And then we realized that our product protects your bone marrow cells from the damage of chemotherapy. That's why this is one of the most specific functions. Okay, now it's not just the PPAR extract that works in this this part of the protection. It's all the combined nutrients of the extract. And that what happens is that when you expose our extract, chemotherapy, our extract, and the bone marrow cells stay intact. So that's what the research shows and proves. And this is already happening in our patients. So we saw it in our patients and we said, oh, we want to know how it works. Okay, so I just want to share with you honestly the process in which the evidence that you're looking for, it happens first. Then we found out why. Okay, drugs are different. They want a specific result, then they keep improving the drug until they get the result. For us, it actually worked first on someone. Then we were wondering, oh my God, it works for someone. How does it work? And then we direct the research to find out. So that's the difference, I guess, between natural products. Like, for example, I know in Philippines, there's this brand called there's this company that sells mangosteen extracts, right? As a health supplement. Come on, as Asians, we've been eating mangosteens for so long. So I guess there was scientists who said, wow, people who eat a lot of mangosteen seems to have this good health. So they started to research what's so good about the mangosteen, right? And then they started to improve and isolate and try to go after the key things about the mangosteen. So similarly for us as well. So I think what I wanted to say was that this protocol did positive results for someone, and that's for many people, and that prompted us to the direction to do the research to now understand how come it helped these people. And then when we finish the research and we now understand the mechanism, we are confident to share it with you in the way that we have been doing tonight. And I think that's the evidence that you're looking for. Now, for the specific evidence that if you want understanding, go to Simply Nature International YouTube channel, look for the Doctors Forum. If it's not enough, next Thursday, come back on this show, ask me again. I'll get someone to send you technical data. Okay, all right, if you're so inclined. And don't forget, you can also ask Jen. She's actually a licensed pharmacist. So she actually understands the more technical aspects of our product. Okay, I hope I answered your question exhaustively and gave you the confidence to take whatever Dr. Jansen recommends to you in his consults.
Yeah, I can see a lot of questions coming in, but that's all we've got time for today. But don't worry, we will answer each of your questions next webinar or via direct message. And we hope to see you all in our future webinars to come. Do you have any topic in mind? So you can suggest by commenting down below. See you same day, same time, every Thursday night at 7:30 p.m. I would like to know whom of our viewers here are taking trastuzumab, because next week we will tackle chemo side effects on breast cancer. So just before we say goodbye, kindly give our viewers your parting words for tonight, starting with Doc Jansen.
Yeah, so I just want to thank everyone for attending, no? This program would not have been this long, okay? If it weren't for you guys, so thank you so much. Please continue watching and ask your questions. This is your opportunity because this is free, okay? So, and of course, for all our cancer patients out there, even if when you feel that there's no hope, and the options are limited, it's not true, okay? There will always be options where we can do something for you, okay? Especially for those patients who have what we call that you're in a therapeutic dilemma already. If you do get treatment, it will harm your body. Or if you get this treatment, then the other disease will get worsened. Okay, even if you are in that kind of a situation, there's always something that we can do. Okay, you just have to be you just have to do something and be courageous. Okay, so that's it for me. Back to you, Jen.
Sir Shyan?
For me, I just wanted, because I've seen the encouraging remarks, feedback from the Facebook thanking us for the program. I just want to say that I want to thank you guys, all of you. And I especially want to show my appreciation to Dr. Jansen, because, you know, I've attended many health talks that are designed for general viewership like this. And many times the hosts or the speakers talk very generally, right? Like in general concepts, or they say that this vitamin or this product is good for this, good for that. Very few of those speakers can actually speak, reference actual medical drugs and say that, oh, you're taking this drug, yes, this drug does this, is good for you, please continue, and things like that. So, you know, Dr. Jansen, as I listen to our own tapings, I feel very proud, all right, of being able to do this program with you. I feel so good that we can bring fact base, you know, not about hype or generalization, that you actually speak and know the medicine that our viewers are taking. So many times you tell them to continue taking the medicine, you know, and so many times you share with them why their doctors gave them this medicine, because, you know, many viewers come on programs, on health talks, angry with their doctors. Maybe they are disappointed because the drug they're taking is not working, so they just want to hear someone bash the doctor, you know. But you know, this does not help the patient, right? And also, I'm so glad that my fellow speaker, which is yourself, gives understanding to our viewers. There's no bashing of any drugs. Instead, we explain what those drugs do. We help the patient make better choices. Because at the end of the day, what really we want to do over here is to help you, the viewer, understand what you're going through, and not let people sway you left and right with whatever they're trying to achieve, but instead to give you the tool to make the right decision for yourself. You know, and because no matter what people say, at the end of the day, it is you who will suffer the consequences, or it'll be you who will get the benefits of the healing. So it is so important for everyone. I want to encourage everyone to attempt to understand as much as possible about what's happening to you when you're fighting cancer, when you're fighting your disease, because you can just listen to someone, but at the end of the day, the pain or the healing is going to be your body, and you're the one experiencing it. So please, we're always happy to continue to provide you the avenue where you can ask your questions, and you can increase your understanding, and you can be in better control of the healing that you will be receiving. So make the right decision to empower you, and we'll see you here again next Thursday. Very good, very specific, right? What was it again? Whoever is using what drug?
trastuzumab.
Oh, right. See, very specific. Exactly what I'm saying. I'm so glad to have you do this program with you, Dr. Jansen. Thank you for bringing a very balanced, factual-based program to all our viewers. So to everyone, please recommend to your loved ones. The more people watching, the more excellent questions, the more answers we all get.
Yes, so thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.